Okay.
Well, good afternoon, everyone. And let me first introduce the folks who are with us that are not members. We have Wendy Johnson. Wave your hand, Wendy. We have Alicia Brown is with us again, folks. And she's one of our veterans and nurses that was with us before. Don Sloan is with us. Robin Staggers is with us, Cody Davis, Jim Gleffy, Monica Samuels, Priscilla Bennett. I don't know who Miss K is. Who's that? I don't know. Who's Miss K?
Yeah, I can do that.
Okay. She doesn't want to reveal herself. But we have Valerie Creedon with us today, and she is the program manager for Jesse Brown VA Medical Center, and she was appointed on October 29th of 2007. Since the program was retitled to Transition and Care Management, the TCM program is an interdisciplinary clinic that offers case management, mental health, primary care, recreation therapy, and groups. The clinic is also available to offer services via appointments, walk-ins, and VA Video Connect. The TCM program was initiated by her. Woohoo, Valerie, good for you. When she secured space and support formed leadership for a clinic that is now seen as a best practice. Previously, she worked as a licensed clinical social worker at JBVAMCA's home-based primary care and acute medical surgical care programs. She is currently detailed as Jesse Brown's VAMC COVID-19 vaccine clinic manager. She received her MSW from the George Williams College of Social Work at Aurora University in 2004. She's a graduate of Bloris College in Dubuque, Iowa, where she received her Bachelor of Arts degree in psychology in December of 1996. Valerie, we're excited to have you with us and on with the show. It's all yours.
Thank you. If I share my screen, I'm wondering if you can all see that.
You'll be allowed.
Let me just ask first, before you begin there, I think it's Nathaniel's microphone is open, but if anyone has their mic open, we had some background noise during the intro. And then take it away, Valerie. Thank you for being here.
All right. Do you see just the one screen serving those who served us?
I see
yes.
I see two. Isn't that?
VA mission and values and yours.
Yeah, I see it. I saw it.
This one?
Okay.
This one? There. Okay.
Okay.
I think that is what it is. So I have a lot of slides about kind of the services that we have and resources. So hopefully if there's any veterans in the audience, they can be of assistance to you all. Also, if you are talking or working with veterans, one of the biggest asks or requests or things that you could do to help us help veterans would be to provide them this information, correct information. There's a lot of myths out there, and that can sometimes prevent people from receiving health care or services that they're entitled to and that they've earned. So I will go through these probably a little quicker than if I was providing it directly to veterans for resources, but I know this is recorded so you can see it again. I am happy to stop if you have any questions. I can't see if you're raising your hand, so just, kind of butt in. I'm happy to talk about that. And if we run out of time, I'll speed things up a little bit. So the VA's mission is to care for those who have borne the battle and for their families, and our values are something that we call I-CARE, which is integrity, commitment, advocacy, respect, and excellence. And I know so many of the staff in all the clinics I work and in all the hospitals I've been at definitely try to embody this and try and get that across to veterans that we're working with. Many of the people we work with are veterans themselves. One of the things I like to talk about in all of my presentations is that the VA is made up of three different sections, kind of. because sometimes people lump us all together. We have the National Cemetery Administration, Veterans Health Administration, and Veterans Benefits Administration, and people often confuse VBA and VHA together, and they think we are the same thing. So if someone is going to get their benefits exam, they think that now the VA hospital knows what's going on, and they can sometimes get frustrated if we're not following up with them, but really we're totally separate sort of entities. We do work together. I kind of liken it to the police and the fire department. They both work together, they need each other, and they help each other, but definitely the chief of police is not going to approve like a fireman's promotion or something like that. So I just ask that you all keep that in mind. The VBA are the folks that give exams for veteran service connection compensation, pension. There are services available for education assistance, home loan guarantees, life insurance, all of those assistance, kind of anything that's associated with money. And then the healthcare is a little more kind of obvious. We work with veterans and their medical needs. So if anyone is interested in applying, just so you all are familiar with it, there's 3 easy ways that you can do that right now. You can walk into any medical center and fill out this form called the 1010-EZ. You can find it online if you want and fill it out ahead of time and bring it in with you. If not, you can walk a veteran right into a hospital and they can sign up right then and there. You can use the e-benefits link and complete an application online, or you can call the 1-877-222-VETS, which is 8387, to get enrolled or to enroll yourself, or if you have questions about eligibility. There are some special eligibilities. The most current special eligibility is the combat eligibility, and that's for people that have served post 9/11 and have received either a combat medal ribbon or a campaign ribbon. Anyone that has done battle for the United States overseas right now is eligible for 5 years of free health care. That also gets them enrolled, and once they're enrolled, then they're in the system, and as long as they continue utilizing services, they stay enrolled in the system despite all the other eligibilities that might be going on out there. So part of our job and what we would love help with is outreaching to our returning combat veterans or anyone that has been deployed anywhere and asking them if they've been enrolled at a VA for healthcare and getting them in. Because once they're in, then they can continue to use that service. But if they've waited too long, they may have to meet other eligibility criteria based on whatever the law is at that time. And we don't want them to miss out on any services that they could have. And they get a couple other free benefits that go along with that during those 5 years. They don't get a copay for anything that could be related to their combat. They are also eligible for dental treatment within 180 days of separating, as long as it wasn't provided right before they were released. We have a whole clinic dedicated to returning combat veterans. It's called the Post 9/11 Military to VA Case Management Program. It's on the 10th floor of our building. Heinz is located on the first floor. I can't remember which building, but they will definitely direct you there. Level also has it located on the first floor of one of their buildings. We were previously titled, and when I sent this in before I left 2 weeks ago, to Clerk Yarborough, we were called Transition and Care Management. We have since been renamed to Post 9/11 Military to VA Case Management Program. We've had lots of other names. We're all the same program. They just keep trying to get it right so that we can reach the most veterans. We were previously called Post Deployment Clinic, Combat Case Management, OEF, OIF, OEF, OIF, OND. At one point, someone asked me why I was reciting the alphabet when I answered the phone. That was one of the reasons we transferred that name. But so nationwide, you will, if you're working with any post 9/11 veterans, that will be our new name. Hopefully it will remain that for quite a while so we can ease the confusion around with everyone. In our clinic, we have case management, primary care, mental health, recreation therapy, all located in one place. We do appointments, we do walk-ins. You can come in, you can bring someone in if you have someone who has been hesitant to come in and get care, but you have a good relationship with them. You can walk them right up into our clinic and we can start the process there. Our job basically is to advocate for these veterans and help them with that transition from the DoD to the civilian life, but we're available to provide mental health, psychosocial assistance, help finding school, help finding childcare, help finding food, any of those things. There's a lot of myths, many of which are that have stopped people from coming in or stopped getting other people helping them get in when they say, oh, I can't go in because of this. Some of those are things like they have to be separated from active duty first. All VAs are able to help. We just have to get authorization, which we can do. We're all very well versed in how to do that in the post 9/11 military to VA program. We can schedule appointments. You don't need to bring in your DD-214. It makes things easier and it helps, but we can work around that for the most part as long as it's in the system. In fact, one of the great services that Clerk Yarborough provides is registering people's DD-214s. So that's one resource where people can go and find their DD-214 if they need it. We don't need a means test before that's their income for combat veterans. So if a combat veteran tells you they're making too much money, if it's within 5 years, they're still eligible, they can come in. But if it's after those 5 years, they've missed that eligibility, that special eligibility period. So that's why we really want to get them in ahead of time. At one point during the OEF, which is the Operation Enduring Freedom, Operation Iraqi Freedom, Operation New Dawn conflicts, we had 51% active duty and 49% National Guard and Reserve members over there. So many came home and had good jobs that they returned to and might have otherwise been outside of the income eligibility. But with this, they're able, if they apply within those 5 years, to get in. So we try and get people in, get this word out to everybody. We do outreach events. I mean, with COVID, things are a little bit different, but we try and get out. So if you have events, we're actually working on getting a whole outreach committee here at Jesse Brown. Heinz has got an outreach staff as well. We're happy to come out. The other cool thing that we're doing at Jesse Brown right now is, well, actually at all VAs that we're trying to get the word out, we are, as many people are, we have vaccine. We have a vaccine clinic, which is where I'm working right now, but we're able to give vaccine to just about anyone associated with veterans. We can give a vaccine to anyone who served in the military. They don't have to fall into the criteria, the eligibility criteria for healthcare or benefits. If they served in the military, they're eligible to come on in and get their vaccine. They could be in the National Guard, the Reserves, the Coast Guard. They could be non-activated Guard or Reserves. They could be commissioned officers of the National Oceanic and Atmospheric Administration or the U.S. Public Health Service. They could be cadets or midshipmen of the U.S. military academies. It doesn't matter. We'll see them all. Spouses of veterans include every spouse you got. So traditional marriage, same-sex marriage, common law marriage. They will take spouses that are considered, if you consider your relationship spousal, we will be able to vaccinate you. You just need to provide the name of the veteran. Caregivers of veterans could be friends, family members, neighbors, could be doing tasks like helping them cook, clean, bathe, but they could also be tasks as simple as helping with transportation, helping with grocery shopping. If you're a caregiver veteran, all you have to do is provide that name and come on in and we can give you a vaccine. And then there's CHAMP VA recipients. If you take your phone right now, you can hold it up on the photo setting and hover it over that little QR code on the screen. And they will, oh, what is this? There we go. Sorry about that. If you put it over that little QR code, it'll take you to a website for the VA. In that website, it says sign up for a vaccine, and it'll take you to the registration section for anyone that's not already enrolled in healthcare. If someone's already enrolled in healthcare, they can come on in and get their vaccine. And that has our phone number on it for our vaccine clinic, 312-569-5801 if they want to make an appointment. Or you can just walk right in and get your vaccine. We have plenty of vaccine to administer at this point. I just wanted to make sure everyone was aware of all of the healthcare services we provide to veterans. We're pretty all-inclusive, and we, in addition to sort of general healthcare services, we have specialty healthcare services as well. There are so many that I know the screen got a little small with the typing, but the bottom line is the VA is one of the largest healthcare systems in the United States, and we have services available, if not at our VA, at another VA nearby that we can get you to those services. And then with the Mission Act, we can also get you to services in the community if it's not something that we offer on site. But as you can see, we offer several services on site that we are trying to get our veterans in to utilize. The VA is working towards getting everyone in a new mindset, and that mindset is whole health, where we put the patient, the veteran, in the center of the circle. So it's not the doctors telling the patient what they're going to do to fix their health care. It's the doctors asking the patients, what's going on with them? What do you want to focus on? What can we do to help you? And providing information and going and utilizing the veterans' wishes and information and choices first and foremost. We have lots of mental health services. I included this slide because it has lots of phone numbers and links that you can check out. We have a homeless hotline number, 1-877-424-3838. If you walk up to a person on the street who may be homeless and you happen to have this phone number stored in your phone, you could give them a call and see if they could provide assistance, immediate assistance to this homeless veteran. Another great phone number to put in your phone if you are working with a veteran or have a veteran with you would be our crisis line. And they changed the name of the crisis line from suicide prevention line to the Veterans Crisis Line because they don't want people to wait or feel like they need to wait or be in that much pain and crisis that they're contemplating suicide before they call. They want veterans to call as soon as they need the help. And that phone number is 1-800-273-8255. It's 1-800-273-TALK if you have a phone with the little letters on the numbers. And as a reminder, anyone can call that number. You don't have to be the veteran yourself. You can call if you're concerned about a veteran, or you can give it to a veteran to call. When you call, you press 1 to talk to the Veterans Crisis Line. If you are in crisis and you're with someone else who's not a veteran, or if you're with someone who's in crisis is not a veteran, you can still use this number. You just don't press 1. So it's a good number to keep with you guys. The VA, just for your information, has lots of mobile apps. If you want to search them and get a large list, that's the link. VA, it's mobile.va.gov App Store. The next slides are just sort of to show you how many they are, so don't freak out when I go by them too fast. I just wanted to kind of give you an idea that we have so many. There's things like a tactical breather app, there's a PTSD app. Anyone can use these. You don't have to be just a veteran, especially for educational purposes. They're great to have around. It's a way to learn more about veterans and some of these things, and also some self-help and self-improvement for yourself. Like there's a breathing app, a sleeping app. There's a quitting tobacco app. We also, as the VA, have a smoke-free, you can call, text. If you text the vet to 47848, they'll text you a hint about something to do to distract yourself if you're craving a cigarette and you're trying to quit. We have social media where you can direct people to find out more information. We also have on our website, www.chicago.va.gov, we have a calendar of events that will start populating probably as the state starts opening up more and the VA starts opening up more, but we're doing so many things virtually right now. It's a good place to check out. We have a website for veterans that has a whole list of where it's called MyHealthyVet. They can get their medical records there. They can get their prescriptions there. They can request refills there. They can communicate with their doctors on www.myhealthyvet or myhealth.va.gov, or you can search MyHealthyVet. We have this started just before COVID started, but has really been a godsend since COVID started. It's called VA Video Connect. We are able to do virtual appointments with veterans. We can even do them with more than one person connected. It's a secure connection. We'll send you a link and the provider gets a link and you both click in and then you're in this private room where you can talk. The nice thing about that is you don't actually have to leave school, leave work, or whatever you might be doing, your kids' party, to go and meet with your primary care provider, your mental health provider. You can have your appointment. You could step into your office. You could step into your car. You could step into your dorm room and have your appointment. And then if you have a spouse that you want involved and they're at work, they could sign in and join just like we are with multiple people in that secure environment. And you can have your appointments that way. So that's definitely increased since COVID. It was a good thing it started. If veterans don't have the ability to have, you can do it on a smartphone, a laptop, an iPad, a desktop. If veterans don't have those equipment, we can provide them with an iPad so that they can utilize that service. Another great website is www.maketheconnection.net. This is something that veterans and non-veterans, people that are supporting veterans, can go to find out more information. The veterans can go in and click that they are a male or a female veteran, what era they served, and they'll be connected with people from that same era going through some of the same things that they're going through, and it gives them a chance to talk, connect, and read and share stories of success and stress and see how people are getting through and work together on that. It provides a great network for that. Oops. Oh, I went too far. Another service that the VA has that you can refer people to are vet centers. They're in the community. They have different hours. They're a little bit later sometimes, and they're also on weekends oftentimes. They're more of a mental health service in terms of the services they provide, but they were created after Vietnam by Vietnam veterans for people that weren't quite ready to come to the VA. So if you have someone that doesn't necessarily trust the VA and you're working with them and you think they could still benefit from something like that, there's several resources available like the Vet Center with trained professionals that you can access or help them access. And then this is just a slide. I know at the beginning I kind of talked about VBA and the benefits they have. If you have veterans that are looking for their fishing license or if they're looking for their pension or survivor benefits or things like that, you can call the 1-800-827-1000 phone number or go to their website, and there's tons of information available there. We also usually always refer people to veteran service organizations that have lots of answers and are willing and out there to help veterans. Then National Cemetery, one of the big things to help us get the word out would be to let veterans know there's a new pre-need program which can help with the process later on in life after the veteran has passed. It can help their family members not have to go through as much. It gives them a letter with their eligibilities and kind of helps them pre-plan. Some information for veterans that are trying to get around town. There are free services and reduced fare services that veterans are in, at least in Illinois in Cook County are eligible for. You can get the Venture card. You have to bring in your service-connected letter. You can get an Illinois, in Illinois, you can get the designation on your driver's license that you're a veteran, but you do have to go to the Illinois Department of Veteran Affairs and get your DD-214, which is their discharge paperwork, notarized by the Illinois Department of Veteran Affairs first. There's Illinois license plates. There's handicap placards. As a reminder, they've increased sort of the requirements to get a placard. It requires an actual diagnosis. Our doctors are very familiar with this change. They're absolutely able to help fill out the paperwork as appropriate for veterans that are in need of getting their handicap placard or handicaps license plates. And then VA provides travel if you're unable to get to your appointments. For VA travel, you have to call ahead of time and be qualified. There's also a program that reimburses veterans to the nearest VA if they qualify for that. I'm almost done, don't worry everyone. I just wanted to provide you all with the local contacts. That's my name, contact number. Hines has the same program as us, and their outreach post 9/11 military to VA person is Catherine Mazuka, and her phone number is up there. And then at Lovell, which was used to be called North Chicago VA, it paired up. It was the first ever pilot program to merge the VA and DOD hospitals together. So the Great Lakes Military Hospital closed and merged with the North Chicago VA Hospital. And that's Christina Leshy, and there's her phone number and email address. And then the vet centers that I just talked about is Betsy Tolstad. She's in charge of all of the vet centers in the area, and she can direct you to the closest one. There are several. And then regional office has their general number, 1-800-827-1000 for resources for that. I also wanted to point out that it is Armed Forces Day coming up, May 16th. I want to thank all of our veterans in the audience for the services and sacrifices that both you and your families made during your time in service. And sorry I went through that super quick, but I just wanted to see if maybe I could help answer any questions or open discussion.
Well, Valerie, first of all, let me thank you for your presentation. You certainly gave us a lot to you shared a lot with us, and I really appreciate it. We are celebrating Veterans Appreciation Month, and so I was glad that you made yourself available to us. We have 2 more presentations for this month. At the end of the month, we're going to hear from our junior senator from Illinois, who, of course, is a veteran. And we're really excited to hear from her. So, if you would like, you can tune in. You can touch base with Brian Cross. Brian is the Director of Veteran Services for the Clerk's Office. So you can, Brian will give you the information if you would like to tune in. We'd love to have you. Okay, so with that, I want to open it up. What questions do we have? Do we have some questions? I see Kimyata Wellington joined us, and she is a veteran. Hey, Kimyata.
Good afternoon. I'm trying to feed my face at the same time.
Okay, I understand.
I did have a question regarding the I can't think of the name right now, but the office has been closed because of COVID. It was just mentioned about the card, the card to travel free on public transportation. Is that office open yet?
So the public transportation is actually through the city.
Okay.
But what you do need to have is your
the MSP, the pass, the military service pass.
You need, through the VA, before you go, you need your service-connected disability letter stating that you have a service connection, and that's VBA, and that has been closed. It is reopening shortly. I know they are slowly bringing staff in. They are available via email. Also, your veteran service officers, if you've ever worked with any of them, should be able to provide you that letter. If you need assistance getting that letter, please feel free to reach out, shoot me an email, give me a call. Actually, shoot me an email right now because I am currently offsite at our vaccine clinic location. My email is Valerie, which is VALERIE Creedon, CREE Delta Oscar November @va.gov, and I can help you get that letter. Another great resource is on e-benefits. That letter is available if you have an account there. If not, I can help you with that too.
Okay, thank you. Oh, Brian's getting kisses. Wow. Look at there. Hey, I want to welcome former trustee Audrey J. Cox is with us, and she's also a former Rotarian. Who knows, she may be coming back to be with us. We'd love to have you come back, Audrey. Robin Staggers, you have a call. You have a question.
No, I don't have a specific question, but I heard you say that you're not only giving vaccines to veterans. Anybody can come to the VA and get a vaccine?
So any caregiver or spouse of a veteran, but the definition of a caregiver or spouse is very broad right now. A caregiver may help the veteran with personal needs like feeding, bathing, or dressing. They may also help the veteran with tasks like shopping or transportation. And you just need to state the veteran's name. You don't need their DD-214, their driver's license, their birth certificate, any of that information. Just giving their name is sufficient. And so if you help a neighbor who is a veteran and you're the one that's always taking them to the grocery store, then you would be considered a caregiver and could come on in and get your vaccine. Spouses, as I said, is if you includes marriage, traditional marriage, same-sex marriage, common law marriages, if you characterize your relationship as spousal, you can receive the vaccine. And that's also the same requirement. You just need to provide the veteran's name. You don't need to come in with the veteran. You don't need their birth certificate or D-214 or any of that.
Okay. Wow. And I wanted to know which vaccine is being administered through the VA. That is a good question. We have all three vaccines at Jesse Brown. We have moved Moderna to our clinic in Crown Point, Indiana. In order, for safety reasons, we keep them very separate. At Jesse Brown, we are able to administer the Pfizer vaccine and the Janssen vaccine. Okay.
I am not sure what the other VAs have, but we get them, from higher up, so I'm sure they're in the same situation as us.
Okay. And thank you so much for partnering with our Veteran Services Office in all that we do. We are so grateful to have you guys, and anytime we call on you, you're front and center. So thank you so much.
Anytime. We love working with you guys.
Hey, look, I'd like everybody that is a veteran to just raise your hand. Just put your hand up so we can see how many we have on the call. Oh, look at here. Just raise your hand. Okay, I see. Mr. Yarbrough, you didn't raise your hand. You can use the raise your hand button down there. And then those of us who wanted to be, that'd be me. I often tell my story about wanting to be a veteran, and they wouldn't let me because I had a child and they wanted me to give my child up for adoption. And I decided not to do that. I didn't want to do that, but I really did want to join the military. So I get to live my military life through all of you veterans who have. And I have a real, my heart is so open to veterans and wanting to do more and more every opportunity I have to do that. And I think Brian Cross is the same way. That's why we get along so well. We want to make sure veterans get what they are entitled to and more.
So go ahead, Gary. Or Madam Clerk?
Yes.
I just want to also to echo what Robin said, to thank Valerie has been a partner with this office since day one. She was one of our first when we were when we were jumping into the shallow end of the pool 8 years ago, she was definitely there for us. And also, just, as so many of us are proviso folks, Valerie grew up just a couple minutes to the east of us, too.
Oh, great.
Yeah, so
Great.
thank you very much, Valerie, for all your help. You're definitely, if we were putting together our wall of fame, you would be up there for sure.
Oh, that's nice.
May I ask something?
Yes.
Yes. This is a toughie, and
Okay.
you go where you want to go with it. But over my years, I'm 81 years old.
Yeah.
I'm not a veteran, but it just seems every few years there's some kind of scandal or serious complaints about not getting adequate care, having to wait too long. What's your assessment of all this?
So my assessment, I need to put out there, would not be an official statement from anyone from the VA, just my personal assessment.
Right.
And I'm happy to provide that. I have to tell you, I, as a civilian who received my care in the community, can tell you that there is no way I have ever gotten an appointment as fast as I have been able to get veterans appointments within the VA system. I have never gotten as many services in one place as veterans are able to get them in the VA system. I have not qualified for several services that veterans qualify for. I can tell you, I was on an outreach event when there was a scandal that broke about Secretary Shinseki, and the news crew was there, and everyone was very nervous that they were going to come barrage us with questions, and they really didn't. But I will tell you that they did talk to two veterans that go to Jesse Brown, who came up to my table afterwards, and they said, "Hey, the news reporters just came up and started asking us questions." And I held my breath. I said, "Oh, okay, how'd it go?" I was not going to stop anyone. I never would, because we need to hear about things in order to fix them. So I said, how'd it go? And they said, we were telling them good things, and they just walked away. They didn't want to hear it.
Of course not.
So, yeah, I mean, I don't even remember the exact study or the numbers, but it's like if something bad happens, you're going to tell 21 people. If something good happens, you're going to tell 3 people. So, yeah, there are things that need to be changed and things we're always working on, but I think that is something that is in the world, like at a restaurant, at a community hospital, at a school, anywhere you go, there's always room for improvement, and we're always striving to improve things. We do focus groups. We have a new system where we send text messages out, and I'm on a committee where we actually, people think, oh, I'm not going to respond to that. They don't care. It's just lip service. It's not true. I'm on a committee where we go through those things. We report things up to the director's office, and we try and make those changes. Some of the things are bigger changes that are beyond us, but we still try and we at least relay those things. Some of the things are laws, like eligibility rules and things like that. That's not just us deciding, oh, we're not going to serve you because of this. It's because it's the law, and it needs to go up through Congress and get signed and fixed. But that's another reason we try to work with and count on veteran service organizations and civilians and you folks even to, let Congress, let your representatives know about changes that you want to see and to support the VA and the services that can be provided so that those changes can happen.
I really appreciate your answer and your candidness. Thank you.
No problem.
So Valerie, if you see something, say something.
Yes, please. We can't make it better if we don't know.
That's right. That's right. Alicia could talk a lot about this, but and she's not going to, but I've been working with her and a group of nurses who are veterans at Hines VA, and they, you know what, I told them, when we talked about, what the issue was, I said, well, you guys are in the Army, right? Yeah. And you're soldiers, right? Yeah. I said, so go kick some ass. And so that's what they're doing. That is what they're doing. So I'm just really proud of them that they take their profession very, very seriously, being nurses, but they also are, they're military people. They know, and they expect, they have great expectations. And the work that they're doing right now, I couldn't be more proud of them, the work that they're doing, because they did see something and they are saying something. So my kudos to Alicia and her group, and I'm glad she's with us again today.
Karen?
Thank you.
Yes.
Yes, sir.
No, Audrey, I'm looking at Audrey there. She told me something about a connection she had with the VA. You got a 1 minute or something that she can share?
Yeah, 1 minute.
She's muted.
Go right ahead, Audrey.
Your mic, Audrey.
Unmute, Audrey.
There she is.
Okay, well, I have been doing some work and a little research with the veterans on behalf of NAMCO, and I had visited the Italian Museum over in Melrose Park.
Oh, yeah, been there.
Which is something to see, which has a lot of veteran artifacts in there and, information. And just trying to get some information and put it out in the community to benefit our veterans, to let them know what's there. Because too many times there's not enough people that are able-bodied that can get out to give them information, and they're always struggling with trying to find some help or some resources. So I had gotten engaged on that basis.
Okay.
That's great. That's great.
Thank you for that, Audrey.
Yeah. We had an opportunity to go and visit. I didn't know that place was over there either, but in your walkings around the community, it's there, and it's the people there were absolutely wonderful. Brian, what's the name of the place? And the address? What's the address?
2 seconds. I just got an email from them today. Let me open it up.
Do you have it?
I don't have it right at my hands, but because they have a veterans movie night and they have some event coming up right now. I just can't remember it off the top of my head. I got it right
here, Madam Clerk. It's the Italian American Veterans Museum, and the address is, it's going to be on the bottom of the email, of course. The address is, I know it's on 3800 Division Street, Stone Park, Illinois. And their email address is info@iavmuseum.org. As you stated, Madam Clerk, until we went over there last year, right before the COVID hit us, we never knew. And it's so beautiful in there. And the ladies and gentlemen, the vets who run it are really, really some of the nicest people we ever met.
They are. They really are.
Yeah.
I gave my email address earlier, valerie.creedon@va.gov. If any of all the people you're working with or information like that, if you would like to share it with me, you don't even need to send me an email. You just send me the if you have a flyer or something.
Well, let's put your email in the chat.
Okay, I'm happy to post those in our clinic. We have a couple of boards up for veterans to come look up community events, activities, and things like that. Job fairs, movie night. That would be a great thing for our veterans, Audrey.
Oh yeah, exactly.
So Brian, will you put her email in the chat, please?
Sure.
Great. Well, listen, our time is well spent here, but Mr. President, you went over more than 2 minutes on my time. Okay, so I went over 2 minutes. I'm sorry about that, but I'm not sorry. Valerie, thank you. We appreciate you, and I love Jesse Brown.
Thank you, Karen and Valerie. Great job. You did pack a lot of information into a short period of time, and we're glad that you could be with us today. We have one more, I think about 45 seconds from Jamaica Davis. Could you just mention a membership comment?
Yes, thank you. First of all, I would like to say that 2 new members has joined us. Well, I sent them an application, Andre Pate, as well as Gabriel Fakori, and he actually filled out an application and we received it. We are in receipt of it. Well, good afternoon, everyone. As membership chair, I welcome you all to our Veteran Service Lecture Series. Rotary is an international service club. We raise money to distribute to local and international organizations. We are a global network of 1.2 million people, and we have 35,000 clubs worldwide. Rotary is where neighbors, friends, and problem solvers share ideas, join leaders, and take action to create lasting change. We promote peace, fight disease, provide clean water, sanitation, and hygiene. Save mothers and children, support education, and grow local economies. If you would like to know more about us or want to join our club, please contact us at maywoodprovisorotary@gmail.com. Thank you.
Great job, Jamaica. Thank you for all you do. And for everyone, Valerie especially, for being with us today, all of our guests. Gary Waller, you ready with the gong? This meeting is official.
Sure am.
We're officially adjourned. Thank you.